Hi, good morning, and welcome to our Caring for the Caregiver webinar on finding alternative care presented by Sutter Health as well as Community Hospice. We're so happy to have you join us today and are very much looking forward to having our guest speakers present on finding alternative care, as so many of us are caregivers and often have questions about what to do when it becomes difficult being at home and the different resources that are available. So today we are excited to welcome our two presenters. And our presenters are Mary Lisa Kuhn. She joins us from the Golden Placement Services. She is one of the owners with Lydia Parman. She has always enjoyed helping the community and being active in clubs and social services. She recently welcomed her fifth grandchild, and when she's not working, she likes to spend time in San Diego and Idaho. I personally have had the chance to work with Mary Lisa for several years now, and she's just a great asset to our community and has a lot of resources to help a lot of people. So I'm really grateful that you're able to join us today, Mary Lisa. And then our second presenter, who's also joining us, is our very own community hospice liaison. She's a senior liaison with us. Her name is Sirpa King. And Sirpa focuses on hospice and palliative care for residents in senior living facilities and outreach to senior organizations in the community. So when we have a client that comes to us who is needing assistance finding a different level of care, Sirpa is kind of our go-to person as she has a lot of resources and just a wealth of information and some great relationships in the community. So Sirpa, we're very grateful for you to take the time out as well of your busy day to help us and provide some great resources. As always, if you have a question throughout this presentation, please enter it into the chat box. We welcome your questions and your comments. Actually, encourage you to do so. And throughout this presentation, if you would like to ask the question yourself, please just make that known. We're happy to have you unmute yourself and ask that question yourself as well. This time is really an interactive time where we can collaborate as a group. And so we encourage you to participate as much as you feel comfortable. I also would like to remind you that this is being recorded and will be presented on social media as well as on the Community Hospice YouTube channel. And so if you do not want your face or your image to be shown, I ask that you please just turn your camera off. We know you're still with us and invite you to participate with your camera off as well. So with that, I will go ahead and turn it over to Sirpa and Mary Lisa.
All right, good morning. Thank you for joining us as we're going to be going over finding alternative care. Here we go. Many people are unsure where to start when caregiving for their loved one becomes too difficult. It can get very stressful and overwhelming, but there are lots of options that are available in our community, and Mary Lisa and I are going to be going over those options with you. So first, we are going to start with in-home care. In-home care, people also call it hiring private duty caregivers. It is a non-medical care provided in the client's home. It includes custodial care for elderly people, mainly assistance with daily activities, which could be such as bathing, dressing, providing meals, medication reminders. One thing to understand that this is paid privately out of pocket. The cost can be higher than being in a licensed facility. Now you can hire the caregivers a few hours a day. Maybe you want to do a couple hours in the morning, a few hours in the evening, or you can hire them 24 hours a day, 7 days a week. Next, we're going to talk about home health care. Now, home health care is actually a skilled medical care, and this must be ordered by your physician. This could be a continuation from coming out of the hospital or from a rehab center to provide physical therapy, occupational or speech therapy in a home setting. The nurses can also provide wound care, IV treatments, more of the acute level care, but this is a temporary service. So typically you may have home health care maybe a month or so as you recover and get stronger and no longer need that service. And one thing not to mix up, this is not caregiving option. Now, when staying at home is no longer an option, one of the choices could be moving into an independent senior living community. Um, these places are basically known as retirement homes for 55 or older. They're apartments or suites. Many of them are hotel style, living style, where you have secured parking, beauty salons, exercise rooms. You can bring your pets in there. Again, this is paid privately out of pocket. And one thing to note about independent living is that they may not have the assistance to assist you with daily activities such as bathing and dressing and medication management. But you can hire in-home care to come and provide those services in the independent living apartment. And then I'm going to pass this on to Mary Lisa. Go ahead.
Hello, good morning. It's a pleasure to be with you here today. And I know that we empathize with all the many options and all this difficulty of transition. And we are here to help you with the options and show you the different levels of care. On this first slide, you'll see the residential care and the boarding care. Now this boarding care option is a good option. You might not even realize that right next door is a home that offers care for seniors. It's a typical home in a neighborhood, and it's licensed for 6 beds. So they have a caregiver, or the owner often lives in the home, and it carries all the same licensing as the larger places that you may currently know about. It offers med management, personal hygiene, walking transfers and assistance, and it's a very nice level of care because it's a 1 to 6 with the caregiver to the resident. And usually the cost is determined just by need of how much care your loved one needs. Next slide. The next option is assisted living. Now you may be very confident thinking about this because you visited there. It's an assisted living retirement home in a bigger setting. And the older adults participate in yoga or bingo, and they have a big activity list every day. They also help with med management, bathing and dressing, and each level of care can be discussed with you with the care level staff at each individual site. And the services are tailored to meet their needs. And again, the cost is determined by need, and it is typically private pay. Now with these 2 last options that we talked about, and also with memory care that we'll be talking about next, typically because they are licensed with the state of California and because they are actually assisted living, so the person is getting assistance, there is help if your loved one was served in the military. There is help from the VA, and they have a very nice program and you can speak with their representatives on Coffee Road, the corner of Coffee and Standiford or Sylvan, and there are options for some help with that. Also, many long-term care insurance policies can help with this level of care with licensed facilities. Next slide. Now, memory care, this has specialized training for dementia and related behaviors. We all know that caring for someone with dementia, there are many support groups and things in town. It takes a special kind of need and a special kind of attention. So the memory care unit is a residential care facility or a wing of the facility that's designed specifically to meet their needs. So typically, of course, the caregivers take a lot of special training. They have secure access in and out of the building, and the whole program of all of the activities are determined by what all their studies of what's helpful to the people who suffer from Alzheimer's or other dementias. What's helpful about this is sometimes too, they have levels within the building itself. So if someone has a smaller need for memory care, then they're in one section. So it really is a very wonderful way to live out a person's life who are afflicted by this. You know, apart from the emotional aspect of transfer from life away from independent life, from either living at home with no care or with a little bit of care, or living in independent living, it's also the cost that's a big concern when you have to move on to the next level. So there are many options here in Stanislaus County, and it's good to ask for professional help to lighten the load, either from the VA or other professionals who know about all the many options. With home health, that's usually dictated by your insurance company of where you could go. But with these options that we've just discussed, typically it's based on cost or just a social setting of the location of what might work best for the person who will become a resident. Okay, Shirka.
Thank you. All right, so then we're going to move on to more of a higher level of care, skilled nursing care and a skilled nursing facility. Let's say that your loved one or you had an injury or an illness, you've been hospitalized for a few days. The doctor may order you to go into a skilled nursing home for rehabilitation, recovery, to get stronger before returning back home. Now, skilled care at a skilled nursing home is covered by Medicare, Medi-Cal, the VA, and private health insurance. Basically, you would be getting physical therapy, speech, occupational therapy. Other services would be wound care, IV therapy, injections, catheter care, monitoring vital signs, and so forth. This is a short-term rehabilitation. Medicare says that you typically can get up to 100 days, but nowadays I see that it's been about 2 to 3 weeks. And then you would discharge home and possibly have the home health care at home, continuing the physical therapy in the home setting. Now, the skilled nursing facilities also have a long-term care section to them, a custodial side, where you can actually live. Now, the person would have to be needing that higher level of care, meaning that they need help with most of their daily activities, mostly are wheelchair bound or bed bound. The service over there would be provided by RNs, LVNs, the certified nursing assistants to provide the 24-hour medical attention. Now, one thing to understand about living in a skilled nursing home under long-term care, it is not covered by Medicare. You can pay it privately out of pocket, and that is a very high cost. Now, if you qualify for Medi-Cal, Medi-Cal could pay for the room and board, as well as VA and some long-term care insurances might be able to cover the extended stay at a skilled nursing facility. And lastly, the last slide, we're going to talk about hospice care and palliative care. Now, hospice care is for people who can no longer benefit from regular medical treatment and are likely in their final months of life. Hospice ends curative treatment, and now the focus becomes on managing pain and symptoms and providing emotional and spiritual support, quality of life for the patient and their entire family. Palliative care is part of hospice, but it is not the same as hospice is. Palliative patients with serious illnesses or those who are still receiving aggressive curative treatments can receive palliative care to address pain and other issues and comfort. When hospice focuses on enhancing quality of life, can result in a significant improvement in the patient's quality of life with the focus on the person rather than the disease. Now, palliative and hospice care can be received in a private home, in a care facility, in a assisted living community, in a hospital setting, um, anywhere we provide the services for hospice. Go ahead, Kristen.
Okay, so we do have quite a few questions. So I'm going to scroll back up here and we can get started. All right, so do you have to be a certain age to have in-home care or home care?
No, you do not. In-home care, that's typically private pay, so you can be any age too. There aren't any state guidelines on that.
Okay, and what about like home health care?
Home health care is determined by your insurance. And so that would be within your insurance policy and any parameters that your personal insurance policy cover.
What are some important questions to ask when looking for an in-home care provider? How does somebody go about looking for an in-home care provider, as we know that there are many options out there in the community?
Well, there's two ways to think about that. There are in-home care providers that are provided by a service or an agency. And with those, typically the price is higher because it's a company, so they carry all of the workers' comp, employment taxes, and all of that. So that's all computed for you. Then there's the other type of service where you hire someone you know, which may be your someone from church or someone else, a private person coming and helping. And typically, of course, that price is less expensive, but it's always good to find out if your homeowner's insurance policy covers if they get hurt at you're open for the liability of them working for you. So basically, it's more expensive to hire an agency, but there are also pluses because you're sure someone will come and be there at a certain time. And if your regular caregiver can't come, then they'll send a backup one. The other questions you want to ask is how much turnover a big company has, because will you be guaranteed to have kind of the same person on Monday, Wednesday, and Friday? Or do they have enough people if you need to go to a 24-hour shift to cover what you need? So you just need to check with all the different parameters because you may not know what caregiver is coming into the home. Also, of course, they'll ask you if you're comfortable with male or female caregivers because some people have a question with that. So the difference between a care company versus a private person is very vast.
Thank you, Mary Lisa. And I see here one of our participants added a couple of additional questions that might be helpful when looking. And that was, what is your level of experience, which we just talked about? And then what would you say are your most important skills when caring for someone? So would you say it's safe to ask to interview a company and worthwhile spending that time investigating the company to see which company might meet your needs best?
Yes, definitely. And ask for personal references. And also keep in mind that when you hire someone, you're for lack of a better term, you're paying for this person. So if when the caregiver gets there, it isn't an emotional or psychological fit with the loved one, then you're not obligated to stay with that caregiver. Then just let the company know that you'd like to try someone else. Because with having someone come into your home, it's already emotional, and then to not have a fit, that's an even greater problem.
Thank you. What happens if a resident runs out of funds and they're living in an assisted living or a skilled nursing facility? What happens to that resident? What are their options?
So in this case, what's really important to do is before you transition your loved one or make the choice to put them in a specific assisted living or memory care place, it's kind of good to think of the overall picture of what could be coming. Of course, if you think if your loved one has a lot of medical issues and unfortunately they probably will only be with us for another year or so, well, it's just a basic budgeting issue. So, okay, we'll have enough. This is what it costs per month, and it looks like we'll have enough money for the year. So, what we always try to say is kind of to think for the big picture of what will be happening. So you have to think of the other overall budget. Of course, in good cases, people outlive their budget. They live longer, they move to assisted living, they like where they're living, they like the interaction, so it actually extends their life. In these cases, if they run out of money, there's a couple things that you have to do. You may have to move them to a less expensive place, to a place where the fee is not as high. And in situations where they're basically only have their Social Security left, well, that typically, with the places in Stanislaus County, it's basically a minimum of about $2,800 a month now that for in-home, well, I mean, excuse me, for assisted living or memory care, well, really for assisted living, minimum of $2,800 if for a moderate level of care. So if they don't have those kind of funds, well, then they would have to go on Medi-Cal. But the tricky part is they have to qualify. So it's good to plan ahead, and you'd have to move them to Medi-Cal, which means they'd have to go to a skilled nursing facility of the ones that Sirpa talked about, because those are the ones that they cover.
Okay. And Mary Lisa, you know, we often have a lot of surrounding communities around us, right? So we have Merced County, San Joaquin County, and we have a vast community here. So the cost that you just spoke about for Stanislaus County, is it comparable in these surrounding communities to that $2,800, or do you know?
Well, in you know, there are a few places in Merced that are a little less expensive. That's part of what, you know, what we do at Golden Placements is that we have a big database that shows all the different prices and helps us to discern who will take maybe a little bit less to care for someone in that you know, in their current level. And so, but yes, I would say that San Joaquin County has a few more Medi-Cal places than we do, and with different, like they have a really good place in Stockton for memory care, for an ambulatory memory care person who can walk around, and they have to be able to walk around, but have memory care issues, and it's covered by Medi-Cal. And that's very difficult to find in Stanislaus County. Yeah. So it sometimes people are reluctant to do that, but you must move out of the area. Even Sonora has a couple of really nice places that are a little less expensive.
Awesome, thank you for that information. Okay, so regarding residential care, how does a person find a residential care facility, and how do people check references? What does that process look like?
There is a state site that's regulated by, it's their own association called CAHNR, CAHNR.com, I believe. And you go and you can see all the licensed places that are listed there. And it's really important to pick licensed facilities unless you have personal knowledge, obviously, of just someone who personally does it. The licensed facilities, whether they have 6-bed or 600-bed, are all inspected by the same Corps of Inspectors from the state of California. I can provide you, Kristen, with the links to all the sites after this, and then you can post them along with the information from today.
Great, that would be wonderful. Okay. And then a follow-up question on that, what is the typical cost for residential care?
Residential care is typically, that is a huge, that's a huge box of words, but residential care is typically used to be a lot lower than assisted living facilities, but now it's right in the same ballpark. So I would say the lowest is $2,800 for them as well. The plus is you have a 1 to 6 level of care. So typically if your loved one rings their bell or calls for the caregiver, obviously you're in a much smaller setting, so the caregiver can respond quicker because they're only caring for 6 people. The care level in larger facilities is usually 1 to 12, 1 to 10, or 1 to 12. So as you can see, just by sheer numbers, you get a little bit more hands-on. Now, of course, in a larger facility, you have a bigger turnover by hours of caregivers. So if you think your loved one would benefit from seeing lots of faces and different people coming in as you know, by caregivers, then that might be more beneficial. So it's really a personal preference, but the cost is about the same, is on a case-by-case basis.
Okay. And what would the typical price for in-home care be? And is that by hour? Is that by day? Is it?
So the in-home care is now about $27 an hour. And depending on the location, is either a 4-hour minimum or a 6-hour minimum. Now, of course, with the COVID, if your loved one needs COVID care, that number goes up. But they are able to work with people with COVID. They do all the precautions, and they are able to do that, where your caregiver only goes to the house, only cares for the person with the COVID. They don't mix, they don't go from one home to another. So it's very regulated and it's very efficient. I personally had my cousin who needed in-home care, because when they contracted COVID, they were in a 6-bed residential care home, and the care home had to shut down for a few weeks. So he moved back home with in-home care, and I was very happy with the way he just went right through it. He was very pleased, and then he was able to go back to his residential care setting. So if you just do the sheer numbers, $27 an hour times 24 hours times 30 days in a month, you'll see that the numbers are way above $10,000 a month, or, maybe 3 to 4 times higher than being in assisted living.
Wow. Thank you. And is there a central source that people can find in-home care?
There are a couple. There's care.com, which that's the one I was talking about, where it's just individual people. So you go on care.com and Jane Doe answers, and you would personally need to file her taxes, file her payroll taxes and check her references and make sure she's bonded. Or you can go online and find, and look up in-home. We have many great services in Stanislaus and surrounding counties of agencies. And you can check their references, and they are licensed and bonded, and they do all the payroll taxes.
Wonderful. Thank you.
Mm-hmm.
We live in a really diverse community. And so my question is, and Sirpa, maybe you can chime in as well, because it's probably different in a skilled nursing facility maybe, but how do facilities in general meet the cultural and the religious and the language needs of our diverse community?
Well, in the skilled nursing homes, they do have a lot of different workers that come from different cultures and speak different languages. So many times they're able to have translation available and accommodate those with different needs.
Okay. I know from my recollection, and it might be a little bit different now because of COVID and all the restrictions that we currently have with social gathering, but in a communal living facility, right, a residential or assisted living, they used to have like activity centers and have a calendar of events and things like that. Do you know if they're still doing that? If they're able to? Are they being creative in ways to continue to engage and meet the cultural or the religious needs of their residents? Is that something that Mary Lisa,
Well,
do you know?
in the last year, that at a typical setting, the residents are tested once a week for COVID.
Mm,
And as long as there aren't any, any problems within the facility, then yes. I was visiting my brother-in-law just last week, and you put the suit on and you put your mask on, and he comes out and visits. And then when I walked him back in, that everybody's there to greet him. It's beautiful. Now, a few weeks ago, when they did have one case, then each resident stays in their room. And if you go at that particular spot, if you went to visit him, then it was in a very protected way. You could see him through a doorway, but no one could enter. So yes, as long as during their testing, they don't find any staff or any residents that have COVID, then I won't say it's the same, of course, because there isn't as much interaction with people from outside, but I think everyone's doing their best to make it as normal as they can. And the residents are able to move around amongst themselves. And they have lots of, they have their usual 10 o'clock coffee and little pastries and bingo and yoga. And so, yes.
That's great. That's great to
Yes.
hear. I know that COVID has made us all become isolated in
Mhm.
our own ways. So that's encouraging to hear.
Yes, it's wonderful.
And I think that also brings a good point, that when you're looking for these services, that's a good question to ask these people, or how are you continuing to engage your residents, and how would my loved one who's going into a facility continue to be engaged and active and not isolated by themselves. So that's great. That's good to hear. Sirpa, I do have a question regarding hospice and palliative care, and I know the answer, but I think it's really important for everybody else to know the answer as well. And so, how does hospice is not for somebody, I mean, it is for somebody at the very end of their life, but that doesn't mean it's for somebody that might be passing away tomorrow. So can you explain a little bit more in detail when someone might be appropriate for hospice, and how having hospice support can help somebody stay in their place and not have to move to another level of care?
Sure. So hospice evaluation. So somebody with a chronic serious illness where they are starting to show declines in their daily activities, the ambulatory status. And when we do the evaluation, we can determine that this person may have 6 months or less of lifetime. So that's when hospice would become beneficial for that person to provide that care in a home or in a residential care home or assisted living. And what that means is, if a person is, let's say, in assisted living community and they have hospice in place, when their condition changes, if there is a fall or something new is happening, the facility staff will contact hospice anytime, 24 hours a day, instead of calling the paramedics and having the patient be rushed out to the emergency room and being hospitalized. And that really is a big help for family members and for the patient themselves to know that they have the support from hospice and not having to go back and forth to the ER every time something happens.
Definitely.
Thank you. And so
I'd like to interject on that. And when choosing assisted living or boarding care, it's important to double check before you make the final decision that they do have a hospice waiver. I would say 98% of our licensed care places in Stanislaus County have them, but you always want to be able to plan for the future, because any move for your loved one is difficult at the first move or second move. So you want to be sure that the facility has a hospice waiver.
Another question. So Sirpa, you just mentioned a diagnosis of 6 months or less based on a terminal illness or a serious advanced illness. Does that mean that, let's say somebody was on hospice for 6 months, at that 6 month mark, if they were still alive and doing okay, that they would no longer qualify? What does that look like?
So Medicare has strict guidelines on hospice criteria. So we evaluate our patients on benefit period monthly basis to see if they still meet that criteria for hospice. If 6 months is up, it doesn't mean that we automatically disenroll you from hospice. If you still meet that criteria and are still showing those specific declines in your condition, we will continue to have you on our services. We have had folks on our services for a couple of years because they still meet the criteria based on Medicare's guidelines.
Thank you. I think that's really important for people to understand, because I think so often we think of hospice and we think of, you know, it's imminent or it's the end. And so I think it's important to understand that it's about meeting someone where they're at and helping them along their journey and supporting their decisions and helping them live the best that they can have wherever they're at, right? Wherever home is. And that can be at home, in their physical residence, in their assisted living, independent living, or even in that skilled nursing facility. And that those services are really additional support. And that brings me to my next question. That's not just about skilled nursing, assisted living, or independent, but how is how do any of these options, I'm sure they don't just provide services to the actual resident, but how do they communicate with the family or their power of attorney or caregiver or whatnot? Is there any type of communication or education to the extended family members as well?
Yes, and that's also on a personal level. So if you're the type that likes to have daily communication or weekly communication or be part of a support group, those are all wonderful questions to ask when you first have your interview. Now, I didn't really mention when we were talking about the different options. Before choosing an option, you need to discern between each type of facility and each administrative staff of the facility. So if the person that's running the place makes you feel comfortable and feel like they're approachable, that may be a better setting for you, because maybe you live out of town or maybe you don't have a lot of time to be there every day. Now, a person that's planning to visit every day, they may have a different need because they won't be contacted by phone. So yes, that's a very important question to ask. I know some now with social, some people use texting where they text a mass text to all the next of kin or power of attorneys and say what's happening at the community that week. Some people do it via blast and email blast. And then there's still that personal touch of you have to have your go-to person at the specific facility. So you know, oh, I can call Susie and she'll answer my question. But you always have to know the name of the person of who you need to call, because when you're home thinking about something like, oh my gosh, I have to be sure that that was handled, you need to know the person that you can call and have your needs met.
Great. And I think there's just one last question here. And it says, are there any adult daycare facilities?
You know, that's a big need for our community, a big need. We had a small one on Tully Road a few years back, owned by 2 people, and it was just really, it was very small, but it was very beneficial. So I was happy to hear that the PACE program out of San Joaquin, I don't know all the parameters of what it takes to be part of it, but they have a PACE program in San Joaquin, and now thankfully Stanislaus, it will be coming to Stanislaus County out in the old Gottschalk's building out on out on Oakdale Road. And I can also get the link to that and give it to you, Kristen, so that you can add it. Lydia and I visited it in Stockton a couple times. It's fabulous. You can take your dementia person that you care for that has dementia and go in the morning and drop them off, and they get to stay all day and have activities and lunch and be with people who are their peers. And then that gives you a respite day if you're a home caregiver. And it's just a fabulous place. In Stockton, they also have a bus system that will actually pick up the person who needs the daycare.
Oh, that sounds like a great resource.
It's amazing. And so I was so happy to hear that we'll be having it in Stanislaus County, and I will definitely provide the link through you, Kristen.
Wonderful. Thank you, Mary Lisa.
Mhm.
Does anyone else have any additional questions, or would you like to add any comments? Serpa, can I ask you to change to the next slide for me, please?
Yes.
I do have one thing. So Community Hospice puts together every year, we hold our own educational seminars called Community Connections. And that's towards the end of the month. You're all welcome to join that as well. But we offer a toolkit, and one of the tabs in here is all about care alternatives. So it has specific information in here on, you know, a checklist is included on what to ask an in-home care provider. You know, it just kind of outlines what you can do or should do before making any types of decision. This is available on our website on hospiceheart.org. So hospiceheart.org under Community Connections, that's under our education tab. And there is an electronic PDF of this available for both Stanislaus County as well as San Joaquin County. And if you would like an actual hard copy of this, please reach out to me, Kristen, at Community Hospice, and I'm happy to mail one to you at no charge. It's just available resource to the community. So you are all welcome to that resource as well. So one more question. What would the cost be to participate in the PACE program? Do we know that?
When we visited in San Joaquin County, it was a startup program, and it was mostly for the members, all the members of this specific insurance. But I will get that information or the link to the information and post and give it to you, Kristen. I'm not sure about the cost or how you qualify.
The PACE program here in Stanislaus County is covered by Medi-Cal, and I believe Kaiser also is a sponsor.
Oh, good. Good.
Wonderful. And is that part of, Serpa, you might know that, is that part of the San Joaquin County, is it a San Joaquin County program?
No, it's completely separate from San Joaquin County, the PACE.
Wonderful.
Mm-hmm.
Okay, I'm sure if you just typed in your Google field, San Joaquin PACE program, you'd probably find some.
That's right.
As well. Okay, are there any other questions or comments at this time? Just a couple comments thanking you for all the information, saying it was very helpful. So I would just like to, personally thank you, Mary Lisa, for joining us today, and Serpa, thank you for taking time out of your busy day to assist us and provide us all these great resources and the great conversation. We do appreciate it very much. And then I'd like to encourage you all to join us for the POLST presentation, which will be next month on April the 8th. POLST is a physician's order for life-sustaining treatment, and Christine Stewart will be presenting. She is on our Stanislaus County POLST Coalition, as well as I believe she's with the state of California POLST as well. And so she'll be providing a wealth of information in regards to how to complete the POLST, what it is, the importance of it, where to put it once it's completed, all that great information. So please join us on April 8th, same time, 11 o'clock, and we hope to see you there. Stay well. Bye-bye.
Bye-bye.